Namaskar, I am Anubhav Ranjan and you are watching Ritam. Every household has that one little pill bottle you reach for when a fever strikes. But what if the medicine that promises to heal is instead putting your health at risk? The increasing presence of substandard and counterfeit drugs in India's pharmaceutical market has raised a serious red flag, threatening public health across the nation. In a recent move, India's drug regulator, the Central Drugs Standard Control Organization, released a list of 53 medicines that failed to meet quality standards. This includes common drugs such as paracetamol, widely trusted for its pain and fever relieving properties. Yet, it's not just paracetamol. The list spans medications for critical conditions like diabetes, high blood pressure, and even essential vitamins like calcium and vitamin D3. These are not just casual supplements, but crucial treatments that many depend on daily. The CDSCO conducted random samplings as part of its monthly inspections, revealing disturbing findings. Among the drugs that failed quality tests were popular antacids like Pan-D, diabetes medication glimepiride, and high blood pressure drug telmisartan. Even Shekel, a widely used vitamin D supplement, was found to be substandard. To put this in perspective, these drugs are staples in medicine cabinets across the country, highlighting the severity of the situation. Adding to the complexity, CDSCO released not one but two lists of drugs that didn't make the cut. In the second list, 5 pharmaceutical companies responded, claiming that their failed drugs were actually counterfeit, yet the investigation is ongoing. This situation isn't an isolated event either. Similar incidents have been happening for years, raising concerns about the safety standards upheld by the pharmaceutical industry. On September 22, 2024, a separate crackdown came from the Himachal State Drug Controller, which banned 59 drugs, 20 of them originating from the state. These weren't just everyday medicines. They included treatments for life-threatening conditions such as epilepsy, mental illness, and severe heart problems. A few months earlier in July, Uttarakhand saw a similar scenario when 5 drugs failed tests, leading to their swift removal from the market. And Rajasthan too faced its own crisis when 10 drugs provided under the state's free medicine scheme were declared substandard. The problem is vast and the statistics paint a grim picture. In 2022-23, alone over 89,000 drug samples were tested, with nearly 3,000 found to be substandard. Alarmingly, 422 were identified as outright counterfeit. These numbers show a worrying trend. More and more drugs entering the market are failing to meet essential quality standards. Globally, counterfeit drugs are not just a nuisance, they are deadly. An estimated 1 million people die annually from counterfeit medications, a staggering number considering that these deaths could be prevented if the stricter regulations were in place. When a medicine that is supposed to cure an illness instead worsens it, the very purpose of healthcare is turned into its head. While authorities like the CDSCO are trying to combat this issue with bans and alerts, the growing list of substandard drugs demands immediate attention. It's clear that the current system isn't enough. Stronger actions are required to prevent such drugs from ever reaching pharmacy shelves. Stricter regulations and more thorough inspections must become a priority before the situation spirals out of control. As one report pointed out, similar concerns were raised when the Himachal drug ban came into effect, highlighting a repeated pattern of pharmaceutical negligence. Jai Hind.